Good morning. Today we have the Prosperity, Livability, and Safety Committee meeting, and with us we have Councilman Dr. Patrick Harmon, Councilwoman Vicki McKeever, and myself, the chair, Monica Peters. And today on the agenda we have a sidewalk presentation. Staff will provide an update on our sidewalk requirements, planning, and funding. And with us is Greg Venables, our Transportation Director.
Thank you, Madam Chair, members of the committee. So as Councilwoman Peters said, we're here to talk about our sidewalks today. I'm going to focus on 5 different areas. We'll talk about our sidewalk ordinance, sidewalk planning, sidewalk funding. We'll look at some of our current sidewalk projects, and then we'll end with our how much we spend on sidewalks. So if you look at our ordinance history, our sidewalk ordinance was adopted in June of 2003. It was effective in September of that same year. And this has been basically the same ordinance we have today is the same one we had back then, with a few minor changes to some language with when we did some ordinance updates. So the purpose intent. So the purpose of the ordinance is to ensure the greater pedestrian safety and the ease of access for pedestrians in the city. Specifically, the intent is to establish locations, promote walking, meet daily pedestrian needs, allow access, clarify timing of sidewalks, and also provide fee in lieu for sidewalk construction. So applicability, so where are sidewalks required when a development comes in? We have subdivisions, so any subdivision of property, a sidewalk is required. Any new buildings or uses, sidewalks are required, and any or most expansions. I won't say any because they have to meet certain criteria for the expansions for them to be required for that. So, that previous slide said unless exempted, so we're going to talk about the exemptions. So specific criteria for exemptions is included in the ordinance in the following areas, and there's certain criteria that each of these have to meet, and I didn't go into detail with these. We can discuss those afterwards if you'd like. But you can get exemptions for residential areas, subdivisions, or group developments, or industrial areas on local and collector streets. We talked about payment in lieu or fee in lieu. So in the development ordinance, there is in transportation improvements 2.7.2.a, the transportation director may approve payment in lieu of required improvements, provided that the installation of the improvements would meet these 3 criteria, or one of the 3. So would it conflict with a state, city, federal roadway project, or other utility project? Is it impractical due to topography, streams, or other environmental limitations? And apart from any immediate minor public benefit, the improvement would be warranted in the future. So an example of this, this is Westmoreland Place up on Johnson Street to the north of High Point. You see there the development was required to install sidewalks on one side of all local streets within the development. They were also required to install sidewalk along Johnson Street, along their property frontage right through there. We do have the Johnson Street Sandy Ridge Road widening project that will start construction in June. So because it was, there will be a project coming in, they met the requirement for them to be able to pay fee in lieu. So what they do is they'll pay, their engineer will do an estimate about the cost of the sidewalk along their property frontage. They submit that estimate to our engineering department. They review it and approve it. The developer will pay the fee to the transportation department. It's held in an account, and so when DOT comes in and does the project and they install the sidewalk, DOT sends us an invoice after the project is complete, and we can use those dollars to help pay for that invoice from NCDOT. So we look at recent history. So we go to sidewalk planning. So we began collecting and compiling a sidewalk priority list sometime in the late 90s. There were about 130 projects that were identified. We had certain criteria that we used to rank the projects, and they're listed here. Pedestrian generators, retail, office, obviously residential, anything that would be a generator, you would receive points. The more generators in an area, the more points you would receive. A warm path, which you see a picture to the right there, Fairfield Road, you would get more points for, obviously, if there's people out there currently walking. Constructability, how easy or hard is it to construct? Are there utility conflicts? Is there slope issues? So you get more points based on the ease of construction of the project. We looked at posted speed limit. Higher speed limits get more points. And then we also looked at pedestrian crash history. If there are any kind of pedestrian involved crashes along the corridor. So in 2017, we developed our first pedestrian plan, and we took a look at our criteria and how we rank projects, and we kept 3, and then we added 3. So if you look there, we have demand, which goes back to that pedestrian generator. We have safety, which is related to the pedestrian crash history, and then we use speed limits again as well. But we added the 3 there in the yellow. Looking at equity, where are the needs? Where are the people that need the sidewalks? Where are they located? How we serve those folks. Micro gaps. So there are areas, we have sidewalks throughout the city, they may not connect. So there are certain areas where you have small gaps. So we prioritize those as well, kind of the low-hanging fruit, so to speak. And then where we have transit access. So you see the picture there on the right with a transit stop, and you also have a worn path there that shows the need for sidewalk. As you see, this plan was done in 2017. We were working with NCDOT to get funding to update this plan in 2026. Here's our priority list. This is a few, as I mentioned, there are 141 projects, so this is just some of the top projects that were prioritized based on that new ranking. Cost estimates. So if you look at the table on the right there, these are all planning level cost estimates. So if you look there for a 5-foot wide sidewalk, the cost per mile is about $264,000 per mile. That equates to about $50 a linear foot for sidewalk construction. Now that cost can be higher or lower depending on some of the things we talked about earlier. Are there utility conflicts? Are there slope issues where you might need a retaining wall? So that could increase the price. And it also, if it's easily constructible, then that price could be potentially a little bit lower than that. But we had cost estimates done as part of the plan for all 141 projects, and you see the cost. And that's based on the $50 just a linear foot. It's just over $25 million to complete all the projects on the list. So sidewalk funding. So how do we pay for our sidewalks currently? So we have, through private development, we talked about the ordinance earlier. So, there's a lot of sidewalk that are being built by the private development. We also have projects that are included in NCDOT roadway projects. I just mentioned Johnson Street, Sandy Ridge Road project. They're including sidewalks as part of that project. If sidewalks are already in place on an NCDOT facility that's being widened or improved, NCDOT will replace that sidewalk and pay for 100% of the cost. If there are no sidewalks present along the facility, the NCDOT will pay 50%, and then High Point is responsible for the additional 50%. And that goes back to that invoice I was talking about before, where they'll send us at the end of the project. We also can construct sidewalk through locally administered NCDOT projects. These are federal dollars that come through the state and come to us. That is an 80-20 split, so High Point is responsible for 20% of the cost of those projects. Congestion mitigation, air quality. These are CMAQ funds or carbon reduction program, CRP funds. These are all federal dollars that help to improve air quality, and sidewalks can be funded with that. That's, again, a federal dollars, and that's an 80-20 split, so the city is responsible for 20% of those costs. And then, of course, city-funded projects. You have capital projects, bond projects, and then 2/3 bonds, which the city will be responsible for 100% of those costs. So just to talk about some of our current projects that we have, this is that C5609L. That's a TIP number, State Transportation Improvement Program. These are congestion mitigation air quality funds, CMAQ funded projects. There are 6 included as part of this project. The North Main Street, East Chester Drive, which has 3 projects along it, James Road, and then Fairfield Road. Total cost of these projects is about $1.5 million, and the city share will be about $300,000. We also have the locally administered projects. We currently have 2 that are funded. We have South University Parkway and then another East Chester Drive project. Both of these projects are the 20% match requirement as well from the city of High Point. And then you have NCDOT roadway projects. So you have Johnson Street, Sandy Ridge Road that we've talked about. It's scheduled to start construction, as I said, in probably June of next year. We have Skeet Club Road, which is the picture that you see here, which has sidewalks on both sides. South Main Street Interchange Project will have bike lanes and then improved sidewalks that will be on Main Street underneath the bridge. The sidewalks that were installed with the I-74 NC-68 project, and then Piedmont Parkway, which is a little bit of an older project. It's been around for a while, but sidewalks are included as part of that project as well. And then we were paid 50% of the cost on that project. So. We also can construct sidewalks through bond projects. So you have our current bond list, Washington Street, which is complete now. It has sidewalks on the north side. Burton Avenue will have sidewalks on both sides, and then Triangle Lake Road has sidewalks on both sides of that facility as well. This is just a conceptual design of what Triangle Lake Road would look like in the future. So how much do sidewalks cost? As far as the cost of High Point, and how much do we spend on sidewalks? So you have NCDOT projects. These are STIP projects and CMAQ funded projects. So these are, and I've included the Johnson Street Sandy Ridge Road project in here. It's a pretty high dollar amount, but cost to NCDOT for those projects is about just over $6 million. The cost of High Point is about $2.6 million. Our High Point projects that are roadway bond projects and our 2/3 bonds is about $3.3 million is what we spend on sidewalks. So total for the city, about over the last 20 years, we've spent about $6 million on sidewalk within the city. And just further break that down a little bit, so we had our 2004 bond projects. We had approximately $1.5 million that were spent for sidewalks on those projects. I think there were 5 roadway projects there. Our 2019 bond projects, we have about $850,000 in sidewalk costs. Some of that will vary because we don't have exact costs yet on Burton or on Triangle Lake Road, but it gives you a good idea. And then in 2014, the council approved spending about $980,000 on sidewalk construction projects. So this is to give you an idea about how we've improved and how we've the sidewalks that we've built over the past several years. So this is a sidewalk map in 2008. You can kind of see there the red is our sidewalk layer. And then in 2024, this is what it looks like now. Just to bring your attention to some of this. So this is, you have, like I talked about, the different ways we can fund sidewalks. So Skeet Club Road is right here, obviously an NCDOT project. We have sidewalks along both sides of that. Barrow Road was a bond project, a city bond project, sidewalks on both sides of that. And then most of this other sidewalk is private development that we got through our current sidewalk ordinance. And that's my presentation. I'll be glad to answer any questions.
Does anyone have any questions?
I do.
Okay. I know, I was looking right at you.
So it looks like there's been 50 miles of new sidewalks since 2008. So what percent of that was city implemented versus private development?
Yeah, I have to go. I don't have I can get that information for you. I don't have that information right now. But obviously when you do an NCDOT project, you're putting sidewalks. Ski Club Road's a long project. Sidewalks are included on both sides of that facility. Barrow Road, both sides of the facility. I mean, if you look at our past bond projects, we put sidewalk on both sides where we can. Obviously, Washington Street's a little bit different because you have the railroad cut.
Right.
Most developers are required to put it, or the development community is required to put it on one side of all local roads. But I would say there's probably been more private development sidewalk than public.
Okay.
Over the past 20 years or so.
So it seems like this really hasn't been a priority, has it? I mean, I sent an email to council about suggesting we do an annual allocation for sidewalks because we have quite a backlog if we got $25 million worth of sidewalk. I mean, we put in money for infrastructure every year to pay for stuff, and it makes sense to add sidewalks as part of infrastructure. Has staff thought about bonds? I think Durham and Burlington just had a couple of bonds that passed that were sidewalk related. So has been any thought about a bond for sidewalks and other related infrastructure?
Good morning, Madam Chair, members of the committee. Damon Duquesne, Assistant City Manager. That would basically be at the will of the council if they wanted to move forward with something like that. So the short answer to your question is if there hasn't been one, there just hasn't been an appetite for it to date.
Yeah.
Other than the examples that the director gave.
Right. Well, they just seem, I don't know, something incidental. I mean, I think we need more intentionality about if we're going to close this gap regarding sidewalks. Because even like Lexington, right, from Centennial to Maine, right, that's a big gap right there. And I see people walking in the road because they don't want to walk in people's yards, right? Right. So it's not very safe. So, all right, thank you.
So if we got staff to take a look at that, would that end up coming back to this committee or to Finance Committee? a way to do some type of sidewalk funding?
It would depend on the options that are available. We could certainly bring it back here to discuss, and then if there were options that this committee wanted to consider moving forward, we'd likely take it to finance at that point, or it would be part of the budget conversation as we do the annual budget, the manager's annual budget.
Okay. So would this committee like to see something like that?
Yeah, for sure.
Okay.
Yes, ma'am?
All righty. And then I had a question, well, any other questions? Okay. I have a question. So the exemption, how easy is that exemption process for the developer if they're in a situation that they want to be exempt as far as time and money?
Yeah, it's, as far as the request, it's fairly easy. It depends on which of those three areas that we were talking about. If it's the residential areas or the group development areas, then that would have to be a TRC decision. So they would submit a request, and then TRC would review that and vote on it. If it's in the industrial areas, it's written in the ordinance, the transportation director has authority, so I grant those. But it's just a process of submitting and then going through the approval process for that.
Okay.
I will say that we've not had, most of our exemptions have come in the industrial areas, I think. We've had a few in the others, but most are in our industrial areas where people or developers are asking for exemptions.
Okay, so the approval process is what, 30 days, 90 days? About how long does that take?
It's a review process, so it'll go to TRC.
Okay.
If it comes to me, it can be done fairly quickly.
Okay.
But if it goes through TRC, it'll have to be reviewed and discussed at TRC, so it could be a couple of weeks,
Okay.
probably.
Okay. All right. There's no further questions, and thank you so much.
Thank you.
And also, I just wanted to add, we did get Councilman Tyrone Johnson did come to the meeting, so he's here with us today as well. All right. Now we'll go to the next item, 2024-430, High Point Police Department Alternative Response Model and Civilian Traffic Investigators Update. And today we have Chief Cheeks, our police chief, to give us an update. Thank you.
Good morning, Madam Chair, members of the committee. Just to give you all an overview, an update on some projects we're looking at in regards to staffing with our alternative response model or response to mental health here in the city, as well as civilian traffic crash investigators. Our recruiters have done a great job over the last 4 or 5 years, continually bringing people in the door, but staffing still, remains a challenge for us. One of the things that it's a goal of mine is to make sure that we remain a full-service police agency and we don't compromise the services provided. But in doing so, we can either stick to the traditional model, which we tried to over the last few years, or we can reimagine, in some facets what that looks like as far as what we're providing. So these are two ways we can do so. To give you some context, since January, we've answered 940 mental health calls for service here in the city. That's about 150 per month.
Wow.
Now, those calls range from everything from someone needing to be committed to a mental health facility to just someone's having a bad day and they need some kind of direction or guidance towards services. Oftentimes, those calls come in through a third party, and we get called because 24/7, 365, if you call, we answer. And so we're kind of the stopgap. What we have long realized, especially here in the last few years, is that we're not always the best solution, even though we try to be. And so in 2021, we started looking at other options. I'll have Major Jurin come up here in a minute. She's kind of led our efforts in kind of investigating and trying to figure out what's the best adaptive model here for us in High Point. So there's two models out there that you'll see law enforcement agencies looking at using right now. The first is your co-responder model. That puts a police officer and a mental health professional in the same car that respond to calls for service together. Now, I just told you staffing is a challenge. So if I don't need that sworn officer there, I don't want them there because they can be doing something else. Also, this get up doesn't always help, right? And so if we can remove the officer from that situation, unless there's a safety issue or a situation where the officer is needed, we prefer to do so. So you'll hear us talk more specifically about the alternative response model, and that is being able to triage those calls and figure out when does an officer need to go, versus a mental health professional. The second part of that is when there's not those calls for service, do we have someone that can facilitate those services that are available before we get that call? That alternative response model gives us those options. And again, Major Jurin will talk more about that here in just a second. So the advantages to an alternative response model, improve the outcomes. Number one, we want to provide, services to those individuals that need it. But if we can be proactive and prevent some of those calls coming in as calls for service by having someone who's available to do those follow-ups and things like that, that helps us on the front end and the back end. Building trust. I say all the time, we're kind of a one-trick pony. We show up to a call, we're going to ask someone to do something. If they don't want to do it, and we're governed by law to have them do it, then there's only so many ways we can do that. And so kind of, again, removing us from those situations when there's not a safety issue will help a great deal. Freeing up sworn police officers. Again, with staffing, I need our guys and girls to be able to stay available as much as reasonably possible. Connect people to services, and then address needs that officers aren't trained for. We do have crisis intervention training, but that is, that's a stopgap, if you will. I'd rather us lean on that when it's 3 o'clock in the morning and we don't have our alternative response team available, but that shouldn't be our 24/7 solution to these calls. Rachel. Major Rachel joined us. She's over our community division, and she'll cover these next 2 slides, which is kind of how we envision that process working for us.
Good morning.
Good morning.
So this is just kind of a flow of how we anticipate the process to work. And the first component of that says 988. Well, the reason for that is if we can increase awareness of the 988 service that's available, a lot of calls will divert themselves away from law enforcement to begin with. So that's a process that's already been started here in High Point. I've been giving out those flyers and trying to raise awareness and putting posters up in businesses all over town for about a year now to increase awareness of 988. So the next level on the flow chart is 911. And so what that is that's how we're going to receive these calls. That's the way that typically happens. Whether it comes into the emergency line or the non-emergency line, those calls are all generally filled through the 911 office. And when it gets there, they'll get answered by a telecommunicator. That telecommunicator will then be able to triage that call and determine, is this a call that's safe for us to send a clinician in the field by themselves to this call? Is this a call where we need to send an officer and a clinician together for the beginning of the call till we determine whether or not it's safe enough? Because if we can't get enough information, we don't want to put anybody out there in a situation that may be dangerous to them, right? So it may be that we start off as a co-response and then move to alternate response because we realize this is fine, they can handle that. We can back out the law enforcement response, get back in service, and let them handle this call. So you'll see here where it says ART, both, or LEO. We're just making that determination. Are we going to have to send the officers to this because of the element of danger, or can we send it by themselves, or do we need to send both? And then underneath, you'll see if we send the alternate response team, they'll have a follow-up component. What we're looking at for that is a limited amount of case management services for that top tier of individuals who are high utilizers of emergency response services. So these folks that we have call again and again and again, we're going to try to give them some extra attention, make sure we get them connected to appropriate resources so we can get them out of that loop of depending on our emergency response services and get them the help they actually need. And then on the other side, if it's a call that law enforcement goes to, whether it's one that was originally a mental health call or not, but they realize there's an issue there, they can fill out a referral form and send that over to the alternate response team. That response team can then look at that and determine how to best connect those individuals with services in the community for behavioral health, human needs services, all kinds of services that they can pair them up with so that we can best utilize the services that are available in our community. Let me slip the slide. Thank you. So this is a logic model. As we've been preparing for this for the last couple years, one of the things that I did is I signed up and took a course through the Council of State Governments, through the Justice Center. and just about this very thing, implementing these kind of alternate response teams. And so one of the things that we did as part of the process for that class was to develop a logic model for our intended response team. And so the first thing is we're going to talk about is what do we need? Well, I hit on this already, community awareness of the 988 program, and then also a community awareness of the alternate response team program once that comes into play. Then we're going to need our dispatch center to be on board, make sure that they're trained and understand how to triage those calls. We're going to need a relationship with our behavioral health, crisis stabilization, and human service resources, which we've already begun working on for about a year and a half now. We implemented a committee called the CART Committee that brings those folks together so we can talk about some of these issues and where behavioral health and law enforcement intersect and how we can better respond to those calls. We're going to need funding to meet the basic needs of the program and clinicians then to be hired in order to provide that community-based response. What we will do once they're in play is those clinicians will respond in teams, and they'll respond to non-crime calls that are primarily behavioral health related in nature. They'll make referrals to community-based services. They'll sometimes provide transportation to service providers. They'll give assistance with immediate basic needs and follow up with case management when needed. What we hope to deliver is calls resulting in those connections to community-based resources, a resolution of community problems, and the reduced utilization of law enforcement for non-crime calls to help with our staffing and just have the right solution for the right problem. For short-term, mid-term, and long-term impacts, the biggest thing we want to do is divert people in crisis away from the criminal justice system, right? Make sure that we're answering the problem the right way, and that we have less uses of force by law enforcement officers, simply because we don't have people this is not in our wheelhouse, and oftentimes we take it further than it needs to go. We don't want that to happen. So right response to the right problem should reduce those uses of force. To address the concerns by our residents about folks that need assistance and are not getting it. And then to reduce our call volume for our law enforcement officers so they can return their focus to crime-based calls and reduce the amount of time that they're spending on nonviolent calls that could be handled with community-based resources. In the midterm, we're hoping that these actions will reduce our jail population, that our mental health clients receive proper referrals, that we have less recidivism with folks after they have proper treatment in connection to those services, that we have increased satisfaction from our community and those mental health clients, and stronger stakeholder relationships with all the folks that are partnering with us on this that we're bringing to the table. And then long-term, the hope is that we will have improved equity in the criminal justice system for individuals who are suffering from mental health disorders, that we'll have reinvestment of some of those funds into crisis prevention response and better outcomes for our citizens, the mental health clients, law enforcement in general, and then a reduction in those high utilizers that tend to spend a lot of our time with. So this is kind of the model that we've put forth, the problems that we want to tackle and solve together with those strong partnerships with our community.
Great.
Awesome.
All right, so as you heard from the information that Major Jurin just provided, one of the things we're looking at is, kind of a holistic approach to addressing the issue or problem. So we have had meetings as well with fire and with the library to make sure that we have a kind of a comprehensive city approach and everything's not siloed off where each department is doing something different and pulling in different directions. So what we're looking at doing, combined with what the library is doing, combined with what the fire department is looking at doing, should all work together here for the city. I talked briefly about, again, maximizing our efforts in staffing. Just want to hit real quick, some other things we've done with converting some sworn positions to, again, be able to free up some of our sworn positions and still provide the same level of service. So we've added another real-time crime center analyst. Our real-time crime center is something we implemented not too long ago. It helps us manage our efficiency by leveraging camera systems here in the city. To give you an example, a couple months ago, well, actually not a couple months ago, about a month ago, we had stolen vehicle, 5 occupants in the car, officer gets behind it, utilizing real-time crime center. Within about 10 minutes, 4 out of the 5 under arrest, stolen car recovered, 2 guns seized. So that before then would have taken us probably a couple of hours, because you got to do a wide perimeter around a neighborhood. You need about 3 times the amount of officers, because you're looking for, people and you don't have any direction to start on. So again, helping with efficiency. We added another community outreach coordinator, which she has already gotten in place and again, helped us with, some of the things we do that are forward-facing in the community. We do a lot of things that are non-enforcement, but traditionally we've been pretty bad about advertising those, because we just focus, when I say we, cops, we just focus on the enforcement side. So those 2 young ladies in that position, they've helped us, kind of broadcast the things that we're consistently doing. Special projects coordinator and digital forensics examiner, those 2 positions are coming next. If you think about everything that's happening downtown and in other parts of the city, that right now is managed by a sworn officer, our special projects coordinator position. Being able to utilize someone who can dedicate their time solely on that will free up that time. And then digital forensics examiner, everyone in here probably has a smartphone. If you still have a flip phone, we can talk after this. But if you think about the majority of our high-level crimes, it involves dissecting information from a smartphone or a smart device. Right now, again, we have a sworn staff dedicated to that, but adding a civilian into that for the certifications and the processes, because it's very time-consuming, again, will help us maximize where our sworn folks are. And then we just talked about the alternative response model with the lead clinician and 2 crisis counselors. We're also looking at a wellness position for the police department. Mental and physical health is a big deal, especially in the law enforcement arena now. We've implemented some things and had great results out of those things, but it's a full-time thing. When you have 300 employees, both civilian and sworn, different levels of exposure. We do annual physical appointments. The last 2 years, we've started mental wellness appointments. We require our staff to go to critical incident appointments with a mandatory follow-up when they're exposed to a critical incident. So those types of things, one, they take a great deal of time, but number 2, because you're dealing with things that are medical in nature, we don't want that information flowing in different hands. And then the civilian traffic investigators, which I'll talk about here next. So there's the general statute that was enacted that allows us to pursue civilian traffic investigators. There's a couple of guidelines that are provided by those statutes as far as the minimal level of training they must receive. I believe it's 4 weeks of training with a state curriculum. We, of course, have already looked at that. They'll receive that 4 weeks, but then they'll also receive additional training particular to the High Point Police Department and the city of High Point before we put them out there. Their vehicles must be different from our sworn law enforcement staff. We don't want any confusion about, who's actually a police officer versus who is not. And then their uniforms must be different as well. And all things that, we've looked at criteria-wise. Currently, just to give you an example, Greensboro, Durham, Wilmington, Gastonia, Burlington, Raleigh, just to name a few, have implemented this program. They've saw great success out of it. When you talk about the volume of traffic and traffic accidents we have here in the city, they would only handle your property damage accidents. If there's a personal injury or if one of the drivers is intoxicated, things like that, a sworn law enforcement officer would still handle that. But as far as, 2 cars trying to occupy the same space at the same time, they would handle those things. We would also utilize them for follow-up with some of our, neighborhood traffic complaints and things like that typically we have to pull the traffic officer to go look at to evaluate, how significant of a complaint it is. So they would be able to help us with things in that regard as well. Questions?
Does anyone have any questions? Okay, good.
This is Councilwoman McKeever. I don't have a question. I was reading where they say that they have a mobile crisis unit, and what it is that people that have knowledge and knowledge and education on mental health people, and so when they get a call, they send them out to the call, and they handle the people with mental health without using the police within that department. So I was wondering, have you heard anything about that? 'Cause I was reading one day and I saw it, and I said that'd be a good deal for us to try to look into and see how well it's run. I didn't check other cities to see if they did it, but it'll help out a whole lot with mental health people, because they said that if they get a call for someone with mental health issue, when you come there, they hear the siren blaring and the lights going, it may make it even worse, because they're hearing all the lights and everything. But I thought it was a good idea, but I just want to know, have anybody said anything to you about that or anything?
So that's one of the things, I mean, we looked at, kind of the different models and ways to go about addressing this concern. One of the main things for us is sustainability. And so sometimes when you get someone that provides a service, is that service particular to High Point, or are we sharing that capability with other surrounding jurisdictions? So with our alternative response, we would be able to provide consistency of service, and if we need, other avenues to come in, that's where that connection piece comes in, is where we can then reach out and say, hey, we have someone in this form of crisis, this resource or this thing helps them, versus, hey, Guilford County as a whole has this available, can you come over to High Point? So we did look at that. We did look at how each agency or municipality was implementing what they were doing, and then the kind of the trick to it was finding out or figuring out what's the best installation of service for High Point.
Okay. All right, thank you.
Any other questions?
Chief Cheeks, when do you think you're going to be able to, with the clinicians and counselors, what's the timeline for their being hired?
So the job descriptions are written, right? Yep, job descriptions are written. We are working with HR to get those positions. We've already identified the positions that we're converting. It's just the process now of getting those positions converted over and then posting the positions.
Okay, so early spring of next year is probably realistic.
I would say hopefully, because obviously there's going to be a level of training that's involved
Right.
and things like that. So it's, unless we snipe some people from other existing programs, there's going to have to be a level of training that goes
Okay.
along with that as well.
Right. Yeah, I'm really thrilled with this because, you see stories all the time in the news about really bad outcomes for people who have a mental health crisis. So I'm really thrilled about this being implemented. Maybe we can promote it through our social media when it actually happens. So, thanks, Chief.
Councilman Johnson here. Question to the Assistant Chief. I believe in one of the slides, it mentioned funding would be needed. Do we know how much funding would be needed?
So before Rachel's response, there's been a lot of obviously internal conversations, especially with the manager, and I think for the most part, we're at the point now where the funding aspect, the staffing aspect, we've figured all those things out. We're at the implementation phase now. She was speaking more holistically of what is all gone into the process. We didn't want to tell you that we started looking at this in 2021, 2022, and we've just been kicking the can down the road. There's been time, energy, effort, and research that's gone into figuring out proof of concept to implementation. Rachel, you have anything to add?
No, yeah, just some of the basic needs will be a radio, a car, some of the things like that, and obviously their salary and benefits. So, we're not looking at, outrageous costs, just what it costs to get some boots on the ground, some people mobilized to start moving with this. And then, transportation to and from some of these facilities as needed that they can do. So, I mean, just some very basic costs like we would have with any new position, that whatever equipment that we need for them and their salary benefits is all we're really looking at.
Okay, great. Thank you.
Any other questions? Okay, I've got a couple. Well, first of all, I want to say congratulations to our Assistant Chief, Rachel Jern, for your promotion last week. I was so honored and blessed to be able to have attended that, so congratulations to that.
Thank you so much, appreciate that.
Yeah. So I wanted to ask also, as far as the community awareness, how are we internally really helping with that? I know Ryan always does such a great job with social media and stuff, but are we really working on that internally, trying to help get that out to citizens?
Yeah, so obviously, we're not there yet where it's
Okay.
an actual thing, but sitting in the audience as well as our police communication specialist, Victoria Ruvio, which is who we harass, task, and bother with advertising and promoting everything we do as a police agency. So yeah, when that time comes for the rollout, if you will, obviously Victoria will take the lead on that. Well, we'll work with city marketing as well, but when that time comes, yes, we will promote and push that out.
Okay, great. And then, so that civil traffic investigator, we always hear problems with speeding. Of course, it's not just in High Point, it's nationwide, speeding. Do you foresee that, really trying to help with some of the speeding issues?
No, now, they will not do traffic enforcement.
Okay.
That will stay on the sworn side, but their existence will help us to hopefully have more time on the enforcement side.
Okay, I gotcha.
Because it does take a constant reminder that the speed limit is not suggested, it's
Okay.
actually law, so.
Okay. All right, are there any other questions?
Maybe we should change the sign to say this is not a suggestion. I mean, as a strategy, just to see if that actually makes an impact.
Okay, well, if there's no other questions or comments, we'll adjourn this meeting. Meeting is adjourned.